Thank you, Nafis.
Hello everyone, I am Dr.Nafis Rahman. Here is my AUSN NBGPH progress report on parental obsessions with the health of their children. So here is my research problem. As a clinician, I have witnessed over-anxious, obsessive and stressed parents who plead and even argue with physicians to care for their sick child. How do we, as clinical professionals, cope with this natural expression of maternal and paternal love when parents demand that the medical team should do as much as they can for their sick child? So here is parental concern. Is it normal to be passionate about your sick child? Parental interest in the health of their children. I am reviewing maternal love, paternal love, cultural norms, social security and gender differences, self-interest and paternal obsessions. Love of others or beneficence demands us to care for other people. This is particularly obvious when it comes to children. My study is a descriptive one. Descriptive ethics is the way people view life, their moral interactions and responsibilities with living organisms in their life, said by our beloved Professor Daryl Messer in his book Bioethics is the Love of Life. So how do we measure? How can we judge if normal parental love is an obsession? Should parents argue with their medical team? Can the stress be measured by an anxiety scale? Compared to other situations, like parental obsession with education of their child and tiger moms. Tiger moms are actually called in China. In China, the moms who are obsessed with their child's education are called tiger moms, which may be compared to our parents who are too much obsessed with their child health. We can use Hamilton Anxiety Rating Scale, which was formed by British Journal Medical School of Psychology. Its main purpose to assess the severity of symptoms of anxiety. I propose to use a scale in interviews with parents with some other questions to describe the obsession. These questions are developed based on a few case studies from my professional experiences. Here is the Hamilton Anxiety Rating Scale. Below is a list of phrases that describe certain feelings that people have. Rate the parents by finding the answer which best describes the extent to which he or she has these conditions. So these are the 14 points. 1. Anxious mood. 2. Tension. 3. Fear. 4. Insomnia. 5. Intellectual. 6. Depressed mood. 7. Somatic. Muscular part of somatic. 8. Sensory part of somatic. 9. Cardiovascular symptoms. 10. Respiratory symptoms. 11. Gastrointestinal symptoms. 12. Genitourinary symptoms. 13. autonomic symptoms. And 14. Behavior at interview. I will also add some of my own questions and try to understand more about parental obsession and how clinicians should respond. So, what do you suggest? Actually, I am here to ask for your recommendations about my thesis, and if you have any inquiry or any suggestion, you can contact me and you can tell me now. Thank you.
Any suggestions or comments? Comments, please.
Yeah. Yes, thank you, Nafisa, for your presentation. What is your variable? Independent variable? Independent variable in this study?
Yes, sir. I will use independent variable.
Maybe I have seen a lot of dependent variables, maybe like 20. But which one is your dependent variable that you are going to measure?
Actually, sir, I have planned to make a questionnaire with these skills, and after using this scale, I will conduct questionnaire in tertiary level hospital, and the variable will depend on the patient's perception. Actually,
first of all, you have to clearly understand the research problem, and from the research problem, you have to define the dependent and independent variables. Dependent variables, main variables, but the independent variable is 1 or 2 maximum. And that have to be clear. That you are going to measure in your study. And then the results will come up with your independent variables. That's the thing. I think it should be clearly known by the researcher. If the researcher do not clear understanding with this, should refresh the title, the research problem and the other things. And I think you should consult with, if you have already the supervisor, he can suggest you or your pragmatic colleagues who are there.
Okay, thank you, sir. I'll take it in my consideration and try to add it in my research. Thank you.
Yes, you may. Thank you.
It appeared to me that measurement of anxiety, maternal anxiety, parental anxiety, is what you try to measure. And in way of measuring that, you take all those systemic scorings and you obtain a score, adding them together, and that score will probably give you the actual measurement of how anxious the parents are. And if you think it in this way, I think this is all right that you're having. So that then it becomes the end measurement of anxiety becomes an independent variable, and all other dependent variables, which actually measures up to the measurement of actual anxiety. You may look at it.
Thank you, sir.
Yes, the questions please behind. Please get the microphone. Come on. Thank you.
Thank you, Dr.Nafis Rahman. I would like to know that what outcome do you expect from your research, and what is your rationale behind of this research in the context of Bangladesh? Why it is important in the context of Bangladesh to do this kind of topic?
Thank you, Dr. Malmoy, for your question. It was a nice question. Actually, I thought to do this research from my previous experiences when I was in my internship in a tertiary level hospital. I have faced a lot of problems in pediatric ward where parents come with their children and complain about the treatments. And sometimes it happens, they shows a lot of symptoms. They come with a lot of huge symptoms that sometimes we have to do the over treatment. So I was just thinking that maybe we can find out that because of this obsession, whether we are doing over treatment to the patient or not. And maybe we can make some guidelines. So we can measure the patient's parents' obsession, and then we can make our treatment according to that. That's all. Thank you.
Thank you for your nice presentation.
Thank you. Are there other comments or questions? Is this a problem that you've faced, anybody? As a clinician? Do you have desperate parents come to you?
So not only as a doctor we face this, we also face this whenever we were children, much smaller. Like parental obsessions regarding health and everything. Don't get out in the rain, you will catch fever. Don't get out in the rain, you will catch cold or something. All these health-related issues, our parents had obsessions regarding this. So we face this firsthand. Regarding Nafis' presentation, Nafis, I think it's a very good topic to do your research. It's a very interesting one. We would be really waiting for the outcome that you get. My one small suggestion would be there are lots of other scales. The Hamilton scale actually looks into stress only, if I'm not wrong. So you can also look into the task scale and exclude the D part maybe, depression, anxiety and stress. So maybe the anxiety and stress can be the things that is causing the obsession. So you can also take a look into that and maybe incorporate that in your study. But other than that, I would say it's an excellent topic to deal with. Thank you.
Thank you, Dr. Rashid. I will take it in my consideration.
Can I go more?
I think we have limited time. Are there any other comments? Okay, so I think please talk to Nafis after the session with more comments, which you have, because we have another 3 presentations Thank you very much. Good job. Thank you.